Good afternoon, everybody. My name is Jonas Seifer. I'm a senior policy advisor with the Western Governors Association, and I'll be your MC this afternoon. Before we get started today, I want to take a moment to acknowledge the timing of this webinar with the ongoing fires in Southern California. I know I speak for all of the organizers here today when I say that our hearts go out to both the folks affected by these horrific fires as well as the people responding to the situation. On that somber note, the purpose of this webinar is to learn about ongoing work focused on aligning land management and public health goals related to prescribed fire. These efforts are the product of the Wildland Fire and Air Quality Coordination MOU signed in 2023 by the U.S. Department of Agriculture, the Department of the Interior, the Environmental Protection Agency, and the Centers for Disease Control and Prevention. Here at the Western Governors Association, we are really pleased to see the agencies jointly commit to the shared objectives of protecting public health from the impacts of smoke, while also enabling greater deployment of prescribed fire to reduce the risk of catastrophic fire in the future. Furthermore, it was encouraging to see the MOU catalyze additional regional scale agreements that share the same goals. Today's webinar is intended to share these agencies' work with a broader audience. Engagement and collaboration with state and local governments is essential to the success of this work, and we hope that today's webinar furthers the conversation. Today, we're going to hear from federal leadership about the importance of the MOU, and we'll learn more about the significance of the exceptional events rule for prescribed fire. Then, we'll transition to 3 presentations focusing on 3 local prescribed fire exercises before a brief discussion and wrap-up. For remarks from federal leadership, first I'm going to hand off to Jeff Marzallet. Jeff is the Associate Deputy Chief of State, Private, and Tribal Forestry for the U.S. Forest Service. Jeff, the floor is yours.
And the cascading impacts of that have gotten much, much more severe and critical. A critical tool in our toolbox to do that is prescribed fire, but as you know, smoke is not without its impact. And so, really appreciate the effort of the interagency community, both around this MOU. The Forest Service launched its wildfire crisis strategy in 2022 as a roadmap for reducing risk around communities. And these tools that are part of our wildfire crisis strategy and through this MOU are critical to our success. Scaling up prescribed fire is a must for our success in the future. So as public servants, we all share the responsibility of activating around this and continuing to partner at scales we haven't even imagined yet. So I'm privileged to be joined by a number of our other federal colleagues, US EPA, CDC, the Department of Interior agencies, and so I get the privilege of handing off to my good colleague, Tony from the Center for Disease Control, and much appreciate everybody's time and attention here today.
Thanks so much, Jeff, and thank you all for being here. I'm surrounded by many, many people and many friends. From the Centers for Disease Control and Prevention, we wanted to really just appreciate all of our partners on the land management side, as well as the Environmental Protection Agency, as well as the state, tribal, local, and territorial health agencies that we serve and fund. Public health agencies have long been involved, largely without funding, in the prevention of wildfire, as well as the preparation, response, and recovery. And I think that those are all highlighted, unfortunately, very starkly in the most recent couple of days. One of the things that we've been really appreciative is to come into the Wildfire Management Mitigation Commission report as a noted need for public health, but then also on our own side with the resources we have to help protect communities from smoke. Up to 50% of the smoke in the fine particulate matter across the Western United States is now provided by wildfire smoke. 50% of the particulate matter in the entirety of the air in the Western United States is from wildfire smoke. And so public health agencies have no choice, either by force or by choice, to get involved in wildfire activities. And so we're really just glad to be here. And as a physician, a volunteer for the state of Georgia, I was particularly excited to have Georgia come into the tabletop exercises, where prescribed fire is so central to our ecosystem and how we function in this state, and have a very much what I feel inverse ratio of prescribed fire to wildfire in the South. because of prescribed burning. And I'm hopeful that our colleague Shan Kamek and Morgan will be able to talk about it in a much more eloquent way. But when we're burning in the South, we have 30,000 acres under fire on a given day in March. And so the size and scope of that across, if you were to scale that across the Western states, is really impressive, and very much appreciative for Morgan as well as others for being here. I'm going to hand it off, I believe, to Jenna Knobloch from EPA.
Hi, Jenna Knobloch, USDA. Before we get into the meat of the presentation, I wanted to share a little bit about some of the background and context and milestones of this work. There's a long history of collaboration at all levels on wildland fire and air quality. Looking back to more recent history, in 2017 was the previous version of the Wildland Fire and Air Quality MOU was signed at a federal level. It had its own attached work plan, and a lot of really great work occurred under that. In 2020, the Fire and Smoke Map launched, which is a tool that provides really important real-time information on air quality to the public. There's now a Spanish version available to help make that more accessible to an even wider audience. In 2021, we released the CAFE report, which is an acronym for the Comparative Assessment of the Impacts of Prescribed Fire versus Wildfire, which helped give us a better understanding of the relative benefits of prescribed fire versus wildfire impacts. In the last few years, the CDC and EPA joined the Wildland Fire Leadership Council to help bring those perspectives to that space. Importantly, the bipartisan infrastructure law and the Inflation Reduction Act passed, which brought a lot of energy and funding to the wildfire space. And with that, created the Wildland Fire Mitigation and Management Commission that Tony referenced, that began and really included public health as part of its charge to develop recommendations for Congress in the wildfire space. And so while that was happening, there's continued work across all the agencies. There's been new smoke positions added, both at a national and regional levels. A lot of these are permanent positions. And while the Wildfire Commission was underway, the EPA, CDC, USDA, and DOI embarked on renewing the MOU to really address the major needs across wildland fire and prescribed fire. And that was released last fall with its own ambitious work plan that we've been underway getting done. And so we wanted to take this opportunity to really update you on some of the organizing that's been happening in that space, and some of this continued work as we look to another great year of us all working to really dive into this issue. So I think I'm going to pass it back to Jonah.
Thanks, Jenna. Now we're going to turn to Gabrielle Diebler, an environmental policy analyst from the Office of Air Quality Planning and Standards at the Environmental Protection Agency. Gabrielle is going to be giving us a briefing on the exceptional events rule in the context of prescribed fire. Take it away.
Thank you. I'm going to go ahead and share my screen. I will admit I am used to using Teams, so I'm just going to start by asking folks, can you see my screen? And can you only see the presentation portion of my screen?
You are all set, I think.
Awesome. All right. So as Jonah said, thank you for the introduction. My name is Gabrielle Diebler. I work for the EPA's Office of Air Quality Planning and Standards. I work in this space primarily as someone who focuses on fire policy as it intersects with the implementation of EPA's air quality standards, with a lot of focus in the last year or so on our fine particulate matter standards. So I work primarily on exceptional events. That's what we're going to be talking about today. Exceptional events was a pretty big focus when we early on started talking about doing something like a prescribed fire tabletop exercise, which we're going to talk a lot more about today. And I think the reason why is because, as we'll talk about, the exceptional events rule offers a pathway of regulatory relief to states whose air quality may be affected by prescribed fires that were ignited for certain purposes. And that got a lot of attention since there is such an important focus on increasing prescribed fire on the landscape right now. So I'm just going to give a very high level overview of the exceptional events rule, just to give us a little bit of context before we head into a deeper discussion of the actual tabletop exercises themselves. The exceptional events rule implements Clean Air Act Section 319B. It establishes a process in which air quality monitoring data, that would be regulatory data, could be excluded from the data set that's used for certain regulatory actions. And we would do that because the data was influenced by an exceptional event. One thing I want to note about this is really to underscore that we will exclude that data from use in certain regulatory actions. So that data is still fully available to the public. They have access to real-time air quality data through AirNow, but we also have monitor value reports that can be found online. And you can get the actual monitoring data for a specific regulatory monitor through those reports, and you can choose whether or not you want to include data that was influenced by an exceptional event, or if you would like to exclude that data. And because we only exclude the data from regulatory actions, when we talk about exceptional events, sometimes we talk about them having regulatory significance. And all that means is that the event affected or could affect a regulatory action, which means it might qualify under the exceptional events rule to use this pathway. So exceptional events are defined in the Clean Air Act for us. That's where we baseline the entire rule is at 319B of the Clean Air Act. And exceptional events are defined in that section as an event that affects air quality, is not reasonably controllable, and is not reasonably preventable, and is either a natural event or an event caused by human activity unlikely to recur. So when we talk about prescribed fires under the exceptional events rule, it is important to keep in mind that definition that is laid out in the Clean Air Act, particularly the not reasonably controllable and preventable, and then that natural event or caused by human activity unlikely to recur. So with that definition as our frame to talk about fires under the rule, let's talk about how we define those and how prescribed fire fits in here. First, we'll start with wildfires. They fit in a little more intuitively, I would say. So the exceptional events rule defines fire-related terms, including wildfire. Fire definition, pretty self-explanatory. Any fire started by an unplanned ignition caused by lightning, volcanoes, these are general acts of nature, could also be unauthorized activity, accidental activity, etc., and could also include a prescribed fire that develops into a wildfire. Under the exceptional events rule, a wildfire that occurs predominantly on wildland is considered a natural event. So if we think about the definition of an exceptional event, remember a part of that is that it is either a natural event or an event that was human activity that is unlikely to recur. So for wildfires, if they predominantly occur on wildland, they're considered natural events. So they're already kind of checking off part of that definition under the Clean Air Act. And then for a natural event, we also have a specific definition of a natural event here. And a natural event, events rule is defined as an event and its resulting emissions which may recur at the same location in which human activity plays little or no direct causal role. And we include this definition for a few reasons, but one of them that I just want to highlight is that I hear that wildfires are no longer exceptional. And unfortunately, if we are using the term exceptional in a more colloquial sense, that might be somewhat true. Exceptional in terms of increased frequency. For example, we do see an increase in wildfire activity. Unfortunately, we know that these are happening often. We know that they occur and recur. But just because an event might be recurring or might be happening more frequently, such as wildfires, that doesn't mean that it doesn't fit the regulatory definition of an exceptional event. And under the exceptional events rule, a natural event can recur. And that's why we do see wildfires pretty regularly meeting this criteria. And then finally, wildland, is also, I think, pretty self-explanatory definition. That would be any area in which human activity and development is essentially non-existent. So maybe some roads or power lines, maybe a few structures widely scattered. One note about this wildland definition: there is no ownership specification. So a wildland could be privately owned, it could be publicly owned as well. And there's no acreage threshold. So it could be a variety of sizes, of course. And finally, we'll talk about prescribed fires, which is of particular interest for the conversations we're having today. Prescribed fires on wildland, we do have specific provisions for them in the exceptional events rule. They do fit into the rule a little bit differently, as you might assume. They don't fit into the definition quite as intuitively, but that's why we have specific provisions under the exceptional events rule for prescribed fires. So the definition for a prescribed fire under the exceptional events rule would be any fire intentionally ignited by management actions in accordance with applicable laws, policies, regulations. Don't break the law, obviously. And then to meet specific land or resource management objectives. That's an important part of the definition for prescribed fires on wildland under the exceptional events rule, is that they're being ignited for a specific reason, usually wildfire mitigation or some kind of ecological management. So land and resource management objectives, that's an important part of that definition for us. And under the exceptional events rule, prescribed fires are considered human activities. So they are not going to meet the definition of a natural event, which means they're going to have to meet the definition human activity unlikely to occur. Might seem a little odd, but we'll talk about that. So an exceptional event demonstration. Essentially, when an exceptional event occurs, the state or local air agency realizes that that event has affected their air quality in such a way that it's going to affect some kind of regulatory action from the EPA. In order to have that data excluded from the regulatory action, the state or local air agency will have to develop an exceptional event demonstration. And that is basically just to demonstrate to the EPA that the event is indeed an exceptional event and that it meets the criteria under the rule and should be excluded from a regulatory action. So to meet the criteria for these exceptional events demonstrations, you have to first meet these 6 elements that are laid out here. First is a narrative conceptual model. This is basically just tell us what happened. I can't be everywhere in the country all the time knowing what's happening. So a narrative conceptual model, just describing the event, describe the exceedance or violation at that air quality monitor, and discuss how the emissions from the event itself led to that exceedance. And then a demonstration that the event affected air quality in such a way that there exists a clear causal relationship between the event and the monitored exceedance or violation. So again, just demonstrating to us technically that the event itself led to the exceedance or violation at that monitor. That will also include analyses comparing the claimed event influenced concentrations to concentrations at the same monitor site at other times, just so that we can see the comparison between the event-related data and non-event related data, or what we would consider typical data. There is no specific comparison threshold here. We recognize that some areas are affected by wildfires often enough to the extent that an event influenced concentration may not jump out immediately. We just want to see what is a typical trend over the course of a season or several years. And then number 4, a demonstration that the event was both not reasonably controllable and not reasonably preventable. So that's, again, that core part of the definition in the Clean Air Act. And for a prescribed fire, when we talk about controllability, what we want to see is that some reasonable efforts were taken to control the emissions from that fire and public health impacts. So that would be done either through a certified smoke management program, if the state already has certified to the EPA that it has a smoke management program, that will help you meet that element immediately. You can also demonstrate that basic smoke management practices were used during the time that the fire was conducted. So we just want to know that some kind of effort is being taken to mitigate smoke exposure and risk exposure to the public. And then for not reasonably preventable, for a prescribed fire, we recognize that they are necessary in many cases in most areas of the United States, if not all in certain times. So for not reasonably preventable, we would ask for an agency to demonstrate the benefits that would be lost if the prescribed fire had not been conducted. So you're basically saying it's not really reasonable to prevent this prescribed fire because it's necessary for all of these ecological benefits, for wildfire mitigation, etc. And then number 5, a demonstration that the event was caused by human activity that is unlikely to recur at a particular location or was a natural event. Again, prescribed fires on wildland are going to have to meet the human activity that is unlikely to recur. For that, what we do is we use a recurrence criteria. So we want to see that the prescribed fire is being conducted in an area at an appropriate occurrence rate. You can do this by showing us the natural fire return interval, if that's known, using a land management plan or scientific literature for that area. Show us the natural fire return interval and then explain why that land is or is not being burned at that frequency. We recognize sometimes a prescribed fire needs to recur more often than the natural fire return interval if you are trying to get it back into maintenance, for example, or for fuel loading purposes or what have you. So just explain to us if you're burning more frequently than the natural fire return interval, why that is, likely and preferably backed up by land management resource plans. Or if you are not burning as often as the natural fire return interval, just explain why that might be as well. And then finally, demonstrate that the submitting air agency followed the public comment process. We just want to keep the public involved. When we talk about excluding air quality data from regulatory decisions, we take that very seriously. We want to make sure the public is aware of what's happening and why. So those are the main components for a demonstration. And then we have a separate set of requirements that we call mitigation requirements. And mitigation requirements basically require some kind of public health messaging and communication. We want to see that actions are being taken to protect the public health, because we can exclude air quality data from a regulatory action or from a regulatory record, but we cannot take smoke out of the air. So the public is still going to be affected by it, even if we kind of give you a pass, so to say, from a regulatory perspective. We can't really offer that pass to the public's health. So if an air agency is requesting to exclude data due to an exceptional event, they must take appropriate and reasonable actions to protect public health from exceedances or violations of our air quality standards. So we want to see public notification, make sure that the public knows that their air quality is going to be affected, make sure they are aware that they might be dealing with poor air quality, and then provide for public education so that the public knows what to do about that. Make sure they know that the air quality may be poor and what they can do to protect themselves, what kind of actions they can take to make sure that they are staying safe if the air quality in their area is going to be at a lower level than what we would prefer. And then, of course, provide for any other appropriate measures to protect public health. That this could be education about prescribed fire, certain seasons where you anticipate a lot of prescribed fire, any kind of outreach we obviously really appreciate from the public health perspective. Okay, so lessons learned. As I said, we went into this, or at least I did, thinking that there was going to be a huge focus on exceptional events and all of the tabletop exercises. I was really geared up for it. And what we found actually is only one tabletop exercise really focused on exceptional events. And I think this exercise just really opened my eyes. These are lessons learned from largely from my perspective in participating in these tabletops as someone who really works primarily focused on air quality regulations. So some of the lessons I learned was, first and foremost, that there are many potential barriers to increasing prescribed fire all along the pathway to getting fire on the ground, and even after that in terms of public health messaging and exceptional events demonstrations, which of course have to happen after the event. We also saw that local public health agencies are often underutilized. There are local public health agencies that are ready and willing to help, and those connections and networking opportunities just need to be made and be put underway. Advanced planning, coordination, data sharing, always great, but especially at the local level between air quality managers, land managers, public health agencies, there are a lot of folks with a lot of resources that can help us if everyone's brought to the table to collaborate and plan in advance for these events. And then, of course, continued partnership and collaboration between multiple stakeholder groups. So that would be our land management agencies at the local level, any kind of land management group, anyone that works in this space can really contribute to this effort and this collaboration. And it's just essential if we're going to reach both land management goals and public health goals. We have to continue to work together and continue to build those partnerships. So I learned a lot of lessons from this. And when we learn lessons, we like to do things with those. So at the EPA, at least within my team, at the exceptional events team, we realized pretty quickly that some new tools would be very useful. The first thing we realized is that a lot of the trepidation around exceptional events just seemed to be that it's unknown territory for a lot of folks right now. And it was completely unknown territory a couple of years ago for most folks. So we decided to go ahead and just develop an example demonstration. And that is the Grass Valley Exceptional Events Demonstration for Prescribed Fire on Wildland. We worked with the state of California and the Forest Service to develop that demonstration so that an example exists. And if you want to go and see what a demonstration for prescribed fire would look like, you can do that now on our website. Before we developed this demonstration, there was no example of what a prescribed fire demonstration looked like. So we just wanted to get that out there so folks knew what this might look like if you needed to pursue it yourself. And then we also developed a plethora of technical tools and more data-focused tools. We have some data visualization tools that we recently issued, a new tiering system for particulate matter events, which helps air agencies determine how much technical data they may need for an event, how complex that event may be. We've developed a template for prescribed fires on wildland for demonstrations, and we've updated our FAQs document for exceptional events specifically to update some of our information on private landowners and prescribed fires. And a lot of that effort came out of the work that we did from the Georgia Fire Tabletop, which was extremely illuminating for us. And then we have many other resources online as well. If you are interested in learning more about exceptions, oh my gosh, we have so many materials for you. If you want to head over EPA's exceptional events webpage, we have guidance documents, we have FAQ documents, we have technical documents, we've got the fire and smoke map, we've got e-learning modules. You can really find a lot of fantastic resources there if this is relevant for you. And if you have questions that we don't have time to get to at this webinar, please feel free to reach out to me. I love talking about exceptional events. It's most of what I do. So you can see my email address there on the screen, diebler.gabrielle@epa.gov. If you have any further questions or I can help out in any way regarding these topics, please let me know.
All right. Thank you, Gabrielle, for helping to establish that really important regulatory context. During your presentation, Gabrielle referred to these tabletop exercises, and that's really what our next segment is going to be all about. We're going to hear 3 presentations focused on locally organized prescribed fire exercises that she was referring to. These presentations will cover the specific scenario or situation that the exercise was addressing, who was involved, and what they learned. First, we'll hear about the Georgia Prescribed Fire Exercise. And to do that, I'd like to recognize Morgan Varner, the Director of Research at Tall Timbers, as well as Shan Kamek, a wildlife biologist, fire management officer, and friend of Burner Bob at the Georgia Department of Natural Resources. Shan is also the chair of the Georgia Prescribed Fire Council. Morgan and Shan, take it away.
Thanks, Jonah. I think Shan is out with a family emergency, but I'll be here and try to represent. I'm going to do the awkward share screen. So give me just a sec. See that okay?
You are good, Morgan. Thank you.
Great. Thank you. Okay, well, following on Gabrielle's awesome overview of the tabletops and of the exceptional events demonstration, I'll talk about the Georgia tabletop and try to focus, really kind of stepping back a little bit to talk about this broader issue that she mentioned. That is how we balance biodiversity, fire hazard, human health, and this will be from the Georgia perspective. I'm going to be presenting here on behalf of a lot of other people that were involved in this. Somehow I drew that straw. So the first thing I wanted to do for the audience was to go through and put Georgia and the Southeast in context. Georgia is, in each of the annual counts of prescribed fire acres, is consistently in the top 5. It ranks somewhere like second or third in the nation typically. So that is obviously a bit of an outlier. It's also overwhelmingly privately owned. Something like 93% of the states, if the state is privately owned in the overwhelming majority of forest lands. And it's not just prescribed fire from one end to the other. This map on the left here is a heat map looking at hotspots of prescribed fire, and it shows several, notably the southwestern Georgia, North Florida area that are private quail hunting lands. You can see just north of that along the Alabama-Georgia line, large military installations. And then across the state in scattered public lands, national forests and national wildlife refuges, among others. And so there are local areas where a large amount of prescribed fire takes place, and then other areas where prescribed fire is relatively rare. You can see the city of Atlanta, the metro areas, as an area where prescribed fire is obviously rare, and other places across the state. Also, in context, prescribed fire in Georgia is needed. It's needed for threatened and endangered plants and animals. The overwhelming majority of those species require frequent fire. They have since they came on the planet. And likewise, a lot of the game species that are important both as cultural resources, but as major economic drivers in rural areas. They also require frequent fire for their habitat. And obviously, frequent prescribed fire is important for wildfire hazard mitigation and reduction. Even though people don't hear about them, wildfires do occur in the Southeast and certainly do occur in South Georgia. And so this need is still present. And importantly, because there is so much fire, and this is a rapidly developing state in the Sun Belt, smoke issues are top of mind and certainly related to particulate matter based on the recent rule. So in about almost a year ago to the day, we met a group of 30-something of us, convened in Southwest Georgia, and the participants are there listed, and for the federal folks, all of your appropriate acronyms. You can see the different agencies that were mentioned earlier, the land management and regulatory agencies, and then a large contingent of Georgia-specific agencies, their Department of Natural Resources, their Forestry Commission, their Environmental Protection Division, several non-governmental organizations, the Joint Fire Science Programs, Southern Fire Exchange, the Coalition of Prescribed Fire Councils, and a relatively unique aspect of this meeting was engagement with private land managers. As I mentioned earlier, the landscape is overwhelmingly privately owned, and those that are managing fire tend to be more often than not private land managers who, in a lot of other situations, if you were bringing together this group of people, would be excluded, just basically overlooked because they don't have a federal email address. It's worth mentioning that Brandon Ohl from North Carolina State University did a phenomenal job of facilitating such a diverse group, and was able to help us move to developing 5 working groups at the end of it. And what I'll do now is discuss what those 5 working groups are and what sort of efforts we've made in the last 12 months. The first of those was what we called an area and state planning working group. And the task here was for this working group was to define ecological needs for prescribed fire, work to mesh state wildlife action plans with smoke implementation plans, or at least to pair what the needs were for fire to be able to justify, just as Gabrielle just mentioned, in that exceptional events demonstration. And so what this team that Shan and her colleagues from DNR led was to look at the State Wildlife Action Plan and see what the evidence was for individual species, whether those are threatened and endangered species, like that red-cockaded woodpecker on the left, or a game species like that northern bobwhite quail on the right, what their needs for prescribed fire were, and what sort of natural fire return interval those species prospered with. And that map on the left was generated by the Center for Tree Ring Science at the University of Missouri. I'll come back to that in a bit. Basically, they have developed a nationwide fire return interval map, and they were kind enough to participate and to engage with DNR to generate this for the state to be able to provide evidence for these frequent fire regimes. In addition, beyond the wildlife portion of this, there is a state wildfire hazard map and others that are all providing evidence for the need for prescribed fire, and then how that would translate into the exceptional events demonstration. The next working group was the group we called the Best Practices Working Group. Their task was to develop tools, data systems, and delivery to improve practices for reducing the impact of prescribed fire smoke on sensitive populations. Some of the work in this best practices group had already started because of the looming change to the PM 2.5 rule, but was really accelerated due to the tabletop and the rule. The first of those was to be as public facing as possible. The Georgia Forestry Commission developed a public viewer where this map here of Southwest Georgia, each of those dots corresponding to a prescribed fire permit, and then hovering across each of those, it would say what the purpose for that burning was, what the size, and would give you an approximate location, so that would then segue into why is there smoke near me, and why are they burning? In particular, one of the areas of the state in Southwest Georgia around the small city of Albany, Georgia, was in the process of developing a pilot. And the idea would be that this area that had been prone to PM 2.5 issues in the past, that the Georgia Forestry Commission, working with the Environmental Protection Division and others, would collaborate with private lands managers to develop here is a pilot of how land managers and the state could work together to minimize the public health issues while also maximizing burning. And so via this working group, a version 2 of that Albany pilot was developed that, again, focuses on public health, but also on the need for prescribed fire. Another aspect, although there are several in this working group, was to develop an improved prescribed fire smoke management course, Be Smoke Savvy, that was done in collaboration between Tall Timbers and the Jones Center at Itchaway and the Georgia Forestry Commission. That was taking some of our basic smoke management themes and starting to play them out a little bit farther. The third working group was the Exceptional Events Working Group. Gabrielle just went over the rationale for all of that, but the idea in this case was to streamline the administrative burden of that demonstration process. Again, this is coming from a single location with some relatively unique characteristics, Georgia, but the idea being to provide a template that others might use in similar situations. That map of Georgia looks like a few other states where those average daily values were in exceedance of the new threshold set. You can see that red, yellow, and green. And as part of this, they're facilitated by this process with this team working together. The Georgia Environmental Protection Division submitted a demonstration, exceptional events demonstration in December, and several others also making it down that pathway. The fourth was the Communication and Burner Outreach Working Group. And the goal here was to look at communications broadly with an emphasis on the impacted public and also burners, but really getting to how we mitigate smoke impacts. If smoke is going to be generated, how do we mitigate? So this is a relatively diverse group that is working on topics that I think are very old. It's always, we need to educate people or tell people a little bit more about what we do. And that's a very easy thing to say and a very difficult thing to do in practice. So one of the aspects of this was to take a program that the Florida Forest Service and Tall Timbers had developed in the state of Florida, whyprescribedfire.org, and working with the Jones Center at Itchaway and a really novel social science advertising firm to look at how people perceive smoke, how people perceive prescribed fire, and to look at them changing their actions to avoid and to mitigate. And this effort focused on, for Georgia, the Georgia effort that's now underway, some key zip codes, focusing on place where we know folks are suffering from public health outcomes. It also focused on working with the experts that we pulled together for the tabletop, and they came up with some really neat strategies that if we have more time later, I can go into, but the short version is radio personalities, television meteorologists, and interesting social media. I think that's a good teaser. The other aspect of this, and the part that this working group has been focused on, is also this public notification, public education, and outreach that Gabrielle mentioned just before. And I think that's a real challenge in these landscapes. This image here is that map is the 7 counties that surround Albany, Georgia, in the southwest portion of the state, and those are permitted prescribed fire locations. So it's much more than telling your neighbor. It is about your broad airshed. And I think that's what this group is starting to think about in some pretty interesting ways. And the last working group was the National Conversation Working Group that a few people on here today are participating in. And the goal here was to engage with agency leaders in national forums to educate on the issue, and where possible to elevate to policy discussions. And an evidence of this working group is this meeting today, us engaging and talking about the Georgia experience, how it differs, as you all will see, from Oregon and California tabletops, and really how it fits into the national conversation. It's important to put the Georgia model in context again, as I started. These landscapes are largely private. The goal across these landscapes, almost without exception, is to maintain or increase prescribed fire in the state. The smoke sheds are relatively simple, at least in comparison to dissected topography and wild swings in elevation across the west. And as I mentioned, fire is needed. It's not just acceptable, it's really needed for these economies, the persistence of these species, and as a fundamental tool in land management. I'll close with saying the work in this tabletop is ongoing. I'm pretty heartened by the response we've had both locally as well as nationally. I think this will continue, and I think the value of as you listen to these tabletops and these experiences is thinking about the conversations and the depth of those conversations, pulling people together for a few minutes for a Zoom or for a meeting at work is valuable, but pulling people together for a few days to talk specifically about this tender balance between public health and prescribed fire can be really lasting. And I think this tabletop is a really good piece of evidence that it worked. And with that, I'll close. Thank you.
All right, thank you so much, Morgan. My lights have gone out during your presentation. We'll fix that in a minute, but before our next presentation, I just want to remind folks that if you have any questions that you want to ask, please use the Q&A function. We will address those at the end. Oh, wow, miracle. All right, our next presentation is a little bit different. We're going to hear about the social and ecological resilience across the landscapes project, or the CIRL project. I say this is a little bit different because CIRL already existed before additional MOU signatories got involved. And to tell you more about it, I'm going to hand the mic over to Jason Kuiken, supervisor of the Stanislaus National Forest. Hey, Jason, thanks for joining us today.
All right, well, thanks for having me. And similar to Gabrielle, I'm much more accustomed to Teams, and so I'm going to start to share my screen. And as I go there, what I want folks to know, can you see it all right?
You're good, Jason.
Ooh, all right. So as mentioned, I'm Jason Kuiken, and for the last 7 years, I've had the distinct honor of being the forest supervisor on the Stanislaus National Forest. And if you're not familiar where that is, it's just north of Yosemite. So I'm in California for 60 miles in the Southern Sierras, going up that crest on the west side. Get to manage some of the most beautiful lands this country has to offer. And those public lands, that resource that we have is something that is what drew me into the Forest Service, what drew me into public service. And and I say that because I'm guessing that many folks on this call, whether you work for a public agency or an NGO or just an interested member of the public, the reason you're on this call is probably not just fire, right? It's that underlying reason. It's that underlying thing that brought you to have an interest in the outdoors, and that's probably some experience that you had as a child, or maybe as a young adult, or whatever it was that drew you into this fold of these magical lands that we have in this country and throughout the world. And so for me, that was growing up in central Wisconsin, but being lucky enough to have an uncle on the Front Range of Colorado, where I was able to go and explore and to see the Rocky Mountains and these places that I came to know and love. And yet over time, what I found in those areas is these places that were densely packed with ponderosa pine at lower elevations, or at higher elevations of lodgepole pine, that generally were all of the same age class. And so these places that I thought were healthy and resilient, where I would go and hike and camp overnight and go fishing, and go skiing when I got lucky enough to go in winter. But that wasn't necessarily how that landscape should look and act and function. And I realized I was on the wrong slide for a minute. I'm just trying to warm up here. But
Jason, I hate to interrupt too, but throw that into presentation mode just so it's a little more readable on our end.
I gotcha. No, thank you.
Yeah,
There
I
we go.
couldn't interrupt your story about skiing though. That's not
No, all good. But so these areas that I came to know and love started to change as I moved out to Colorado for the first time in the early 2000s. And they started to change because of this mountain pine beetle epidemic that was impacting at first just lodgepole pine at high elevation, and then started to go into other species, including ponderosa pine. And then there was a spruce budworm outbreak, and and so then you start to see all these red and dead trees that were out on the landscape. And then a couple years further, you started to see fires. So you started to see this landscape change yet again. And as part of that dialogue, it was, how do we manage these vast lands that we're in charge of? And whether it's those public land agencies or private lands, how do we work in partnership to do something different so that current and future generations do have the opportunity to recreate, to have employment through timber management or range management or whatever it is? How do we do that in a meaningful way? And And so that was my first glimpse into partnership opportunities. And so from Colorado, I moved around the country a number of times, went back to Colorado for a little bit, went up to Minnesota and over to Washington State. And it was in Washington State that I really got a taste of large fires. I was on the Okanagan-Wenatchee National Forest and got there in 2014 and had some significant fire years in 2014 and 2015 that had these fires that are impacting communities, impacting critical infrastructure, impacting habitat for a number of threatened and endangered species, as well as killing firefighters on Twist River fire that impacted me. And so all of those impacts really galvanized or made acute this need to look at the landscape differently. And that looking at the landscape differently came in the shape of this social and ecological resilience across the landscape, or CERL project that was at the time, just a few years ago, the largest proactive forest management project in the Forest Service in California, where we're in 119,000 acres of all lands, 93,000 of which are Forest Service, looking at tens of thousands of acres of mechanical treatment, which is necessary so that we can get to this conversation of prescribed fire. Because that map that Morgan showed of the whole United States and those fire return intervals, we're in a spot on the Stanislaus where every 5 to 15 years, below 6,000 or 7,000 feet, we should have fire hitting most acres on that interval, 5 to 15 years. And we haven't. For about 100 years in the CERL project area, we had not seen really any large fires. And so we're aiming towards this conversation of how do we safely and effectively reintroduce fire on the landscape. And again, that's first with some mechanical treatments and then with prescribed fire. And so I was able to sign that first decision in 2022, and we started implementing. And this conversation of, well, how about you work with EPA and CDC on smoke and smoke messaging? And I was thinking, wow, it's a fantastic idea, an opportunity, because when you're looking at prescribed fire, sure, there's the risk of escapes, and that's always there, and yet it's not a significant risk. But what we always have with prescribed fire is smoke, and smoke impacts human health, as Tony mentioned originally, and it impacts businesses because in many of our Western states, recreation and tourism makes up the #1 industry, and it does here in Tuolumne County, where I stand right now. And so how do we have those impacts not be as impactful? And that's through conversation. And so that's my lead into this photo here is one of our 2 field trips with EPA and CDC folks, where we were able to show the CERL project and have conversations about smoke and otherwise. And so from that decision of CERL in 2022, in spring of 23, it was kind of in that February timeframe, started meeting with national and regional EPA and CDC partners, and we then in fall of 23 brought in the Tuolumne County Public Health Office, which was significant. That was an excellent addition. But within that conversation, we were all learning. We were all understanding better what goes into prescribed fire, but also what are those outputs of prescribed fire from PM 2.5 and just other impacts, so that we could delve into this conversation of how do we message in a different fashion? How do we look at working to have all of our public not only understand what prescribed fire is, but also what can members of the public do in order to reduce the risk to their health, to their lungs, what other mitigations can they take from not only just not being outside during those hours, but what are those opportunities with filters and otherwise. And so so that was a significant part. Another aspect of that communication, and this is where that adding in Tuolumne County Public Health was so pivotal, is that and I'm going to say maybe this is just me, but we feel like in the Forest Service often that we have to carry all of the rocks in the pack, and yet we don't necessarily. We have other partners that can help us take rocks out of the pack and carry them together, not just individually. And with Tuolumne County Public Health, what they already had in very good order was communication channels with unhoused populations, with folks that were at human health or vulnerable at-risk health groups, from elderly to folks that have lung issues. And so we were able, through that partnership and connection, to reach those individuals and groups through Tuolumne County Public Health and share that messaging together on why prescribed fire is essential and what can those groups do in order to protect themselves. And so this goes into, we have local impacts, but we also have a larger impact that we need to build upon. So that leveraging local expertise is Tuolumne County Public Health, but it's also Region 9 of EPA. It's the National CDC office as well as the National EPA office, figuring out those avenues to communicate at health fairs, be able to have pamphlets and brochures that we can hand out wherever we are, whenever we're out and about. Those are just tremendous opportunities to leverage. But that communication channel, if you hear nothing else from me, is don't go down that road alone. Go down the road of being able to share in that communication with other public agencies as well as NGOs, because it's public hears things different from different partners. Not everybody wants to hear from the Forest Service about land management, but they will hear from a local NGO on that. Same as with public health. People don't look to the Forest Service as that public health expert, but they do look to that local public health agency. So lean into that and find it. It's an opportunity that I am thankful for every single day. And so that partnership it continued to expand over the last 2 years now, and that expansion has been to hone our messaging, to be able to use this logic model and health belief model so that we can tailor messages to different groups from different groups, be it, again, Forest Service given information on our news releases about human health effects and mitigations that can be taken, be able to have public health follow up that messaging with their own information, and be able to point to different things. And that has, without a doubt, allowed us to implement prescribed fire at both larger scale and higher intensity in terms of smoke output, with fewer complaints coming in. So we have a great relationship with our local air board, and that has only expanded in the last couple of years because of this communication strategy that we're employing. And so all of that, it has a great synergy in being able to reach out to partners. And so then you might be asking, what are some of the outcomes? And I'm not going to go through each of the items on this list, but what I want to stress beyond that, don't try to carry all the rocks on your own, is that be humble, recognize that you don't know everything about everything. And for me, I knew very little about smoke, and I still know just a little bit more than nothing at all, because that realm is so massive. But then what I also recognize is that I don't have to know everything there is about smoke. When you have folks in the Forest Service like Pete Lom that's on this call, to Christina from Tuolumne County Public Health, to all the great folks at EPA and CDC that we're on every other week on a call with, that can help answer questions when I can't. That is an important aspect of how we get through these challenges. And so then that long-term piece is about greater acceptance and understanding of prescribed fire, so that we can do more. So when I say that every 5 to 15 years we should have fire touching these lands, that's a lot of acres, and that is a lot of the West is in that same realm. And so we're going to have to wrestle with this conversation of how do we apply more fire on our terms, the best we can, that has smoke. But what are those trade-offs, and what are those things that people can do? And we're going to best get through that by doing it together, by helping communicate to the public the challenges, but also the opportunities that come with that. And so with that, I'm just going to end with this slide quick that has some contact information if you want it. Christina's fantastic. Ben is our public affairs officer and does a tremendous job. He's in Southern California right now, and so where I'm going to end is Southern California. It's startling to look at those images, and yet I know it furthers the resolve of folks on this call and beyond to pick up that call and say, how do we do this? And how we do it is we do it together. And so thanks for bringing us together on this call. Thanks for bringing the groups together so that we can expand partnerships and make a difference in the lives of all Americans today and tomorrow. Thanks, Jonah. Much appreciated.
Thank you, Jason, for that striking reminder of the power of humility and partnership, and just the value of a well-honed message. We're going to get into our third presentation now. This will be about the West Bend prescribed fire exercise. And to lead that, I'm going to recognize Ryan Gordon, the Assistant Director for Natural Resources for the U.S. Forest Service Region 6, as well as Heidi Huber Stearns, the Director of the Center for Wildfire Smoke Research and Practice within the Institute for Resilient Organizations, Communities, and Environments at the University of Oregon. Heidi and Ryan, the floor is yours.
Great, thank you. I know we're a little bit behind schedule, so I'll do my best to help us catch up some. Get my screen shared here. And I'm going to lead off. And then Heidi will come in behind me. Can you see my screen okay?
Give it a sec to catch up. Yeah, you're looking good, Ryan.
Okay, great. And I hear there's a vacuum coming in here as well, so we'll see how that plays out. Good afternoon, everyone. Like most of the folks here today, I'm representing the work of many through a large collaborative effort. So I really want to recognize that up front. And also call out especially the EPA here in our region really helped to lead out on both this effort as well as a larger regional effort that the lessons learned here will feed into. Wanted to start quickly with a little bit of framing, although I think it's been done well to this point. And so I'll just, really quickly mention that I think for both this group working in Central Oregon, as well as our larger regional initiative here in Oregon and Washington, we really recognize that prescribed burning is about more than just acres. That's really the land management outcome. But the larger goal is really to create more resilient forests and communities while limiting smoke exposure and other public safety risks. And that's really where we've organized ourselves and recognized in particular for this project in Central Oregon, a need and a desire to strategically integrate among the land management, health, and air regulatory agencies. And that's really the proof of concept that we wanted to advance with the project in Bend. And I'm just going to jump right into that, starting with some of the opportunities and challenges. On the positive side, the key enabling factors included really strong leadership support among all of the partners, and really placing this as a clear priority, both within Central Oregon and regionally among all the partners in Oregon and in Washington. I think that there was general and really focused recognition of some of the challenges and opportunities that we had, and a really strong desire to explore those and learn. And the intent here really is to create a model that we can replicate elsewhere. That's what we're really focused on. And so to that end, there was a real commitment to learning, and that's something that I think you'll see here, and Heidi's going to follow up on that as well. Specific to Bend, we had an existing project that had been planned over a period of about 9 years with a record of success. And as you've seen in the previous two presentations, a lot of really great, strong local partnerships, particularly with public health, and in Bend proper, an existing community protection plan for smoke events. And certainly communities in Central Oregon are no stranger to smoke and prescribed fire and wildfire. Some of the challenges there, which are sort of highlighted on this somewhat crowded map, multiple values at risk. We're talking about treating in a landscape that is directly adjacent to the community of Bend, and you can see that here. The treatment units are highlighted in the bright colors, and you can see all the structures on that map. This is a smoke impacted community that cuts both ways, as I think folks can understand. And smoke has a pretty big impact, not just on sort of daily life, but a lot of special planned activities in Bend, particularly in the spring during the burn season. Because of that, there has been over the course of this project a pretty conservative approach, focus on about 230 acres per year. And so the desire here was really to ramp that up. And there was a lot of pressure, in fact, to do that. And we had a pretty short planning timeline and a lot of limited capacity to pull it off. So that really required, I think, that we capitalized on the strong local partnerships that existed already to build some of the key sort of higher level, I guess, partnerships around that. Between the state, federal, local government agencies, as well as NGOs. So when we first got started, we were kind of challenged with how to plan and how to kind of parse this out in a way that we didn't have too many cooks in the kitchen. And that was kind of one of our challenges at first. And so to try to address that, we actually developed a modified IMT structure that really helped to break down kind of the complicated planning process into bite-sized chunks, and allowed us to advance and clearly identify roles and responsibilities and some critical information sharing pathways to keep us focused. We also stood up a pretty healthy agency representative contingency so that we could keep our key agency leads and key cooperators informed and move information back and forth along the way. A lot of this really in service to some of that shared learning and shared understanding that I referred to at the outset. So in terms of outcomes, we managed to bring about a 7-fold increase in acres treated last spring. So I mentioned the average has been about 230 acres per year. We bumped that up to over 1,400 acres. I think one of the really big things to highlight is a really robust joint information team. I think 25 or 30 different agencies had their communication professionals meeting on a weekly basis through the planning and implementation phases of the project. I already mentioned those weekly AREP meetings. And we also brought together a pretty good contingency from the science community to try to collect some data and better understand the impacts that we were having, and also start to peel back, hopefully, the efficacy of some of the communications and pre-planning that is intended to help protect public health. Because again, that's really the goal here, is to replicate this. So from that vantage point, beginning with the end in mind, coming back to this idea of a repeatable, flexible methodology that we can use to study the efficacy of this work. As we try this again in other locations, this coming spring, we'll be working up in Central Washington, looking at the next round in Central Oregon and Bend. What measures can we put in place to really understand the efficacy and learn and start making adjustments? And that really gets into a couple of key places, I think. One is, looking at the impact versus the benefit, trade-offs of smoke exposure now in a controlled situation versus later in a potentially uncontrolled situation, and starting to think in some pretty good layers about how complex planning scenarios are. Sometimes we can't always tell where the smoke is coming from, and we don't always know what to expect on a day. And so it can be a challenge to help communities prepare. And that's one key place that I think we uncovered was really important, to have really good direct communication between folks doing the forecasting and folks doing the communication, and some of that pre-planning with our public health leaders. And finally, I just highlight, I think a big outcome and something that will be continually be important in the future is the opportunity to understand each other's jobs, the challenges, the opportunities, the different solutions. Sometimes when we're looking at something through somebody else's lens, we can come up with some new or innovative ideas. And I think that was and will continue to be a really important objective. And to that end, it was really important to us, and we're trying to really step this up when we move out in Central Washington, to have good multi-agency representation on the C&G within that IMT that we stood up, and have some good mechanisms in place to ensure that we're not getting any siloing occurring within that IMT model, to make sure that we truly are connecting with each other and learning from each other. So with that, I'm gonna hand it off here to Heidi. Let's stop sharing. Are you there? You are there, Heidi. Okay.
Thanks, Ryan. I am here. Let me try sharing again. It was not allowing me to do that. Apologies. All right, I'm going to sort this out quickly on my end, but while I'm doing that, I'll just say briefly, I know we're running short on time, so I'm going to speed through a couple slides quickly. So we conducted an after-action review for West Bend at the University of Oregon Smoke Center that we have a report out for. And what I'm going to talk about are some of the key highlights from that report. And like I said, I am going to speed through these slides. So if folks would like a copy of them, we can also share that afterward, along with the report. So let me just, apologies for this not working. I'm having error messages. So I might just continue here briefly and then drop the link in the chat, because I don't want to hold us up further. Second time presenting today and the first time this is happening. So the after action review that we conducted includes a couple different things. It includes a timeline of when this work took place. The after action review included us following the process throughout, both during implementation and in the planning process, and in the reflections that have happened afterward. And in that time period, we have interviewed people and also run a survey to get a sense of different perspectives from the 12 different organizations that responded to that work. So we have a couple kind of key areas of learning. Several of them are threads that you all have heard already today. And those include things such as communication. And then we also have kind of a list of successes. So I'm going to talk just briefly about a couple of these since we're trying to wrap. So the first one is in the successes with the West Bend project. People involved in the project said that they saw urgent action on the burns, improved communication and coordination from where this work went before, enhancement of public health messaging, and they also noted how more prescribed burning was achieved in this time frame. And so all of these things noted kind of a commitment to continued collaboration in this space for future work in Bend and beyond. In the areas of learning that we identified through the after action review in the report, we identified both areas of learning and some recommendations from people involved that could be used for future work, both within West Bend and elsewhere. So the first area of learning was around redefining how this work protects public health, safety, and property. People were not really sure within this process if the work that was done adequately and equitably protected public health. And so that's kind of a combination of needing more of a full debrief on air quality and smoke data, which is underway, as well as more kind of pre-post assessment work to understand conditions for future projects, and some considerations around redefining how we talk about protecting public health in the context of implementing prescribed burning. And I believe, thank you, Jess. Jess Downey, our smoke center manager, put a link in the chat to the after action review report. Another area of learning was pivoting to whole community, whole airshed preparedness. So this idea of not creating great urgency around a one-off event, but instead creating communities that are able to be prepared and equipped for smoke-related events, whether that's from fire, prescribed fire, or something else. And that would also help relieve some of the pressure that was put on local partners to do this work at a different pace and scale. Three other areas, one that's related to what I just talked about, is accessing overlooked or unaware portions of the population, either people that have unsubscribed from alerts because they had messaging fatigue, or populations that are not reached through some of the kind of standard messaging that might have taken place in certain areas. West Bend, or Bend, the city of Bend has a smoke response plan, which is a communication plan that helped really guide the work within West Bend. And there was a clear need for that to be extended out to Sun River, La Pine, and other areas within the county that are outside that city limit to really have the same kind of strong communication and plan in place ahead of time. And then another key area of learning was addressing organizational challenges in both the planning and implementation of this work. And that includes advancing the coordination that's already underway, taking that further, and clarifying roles, and really looking for capturing those missed opportunities for operations, shared learning and creativity, shared problem solving, and kind of thinking beyond some of the traditional roles that agencies have played. And then finally, another area of learning is around creating pathways for smoke modeling and forecasting to be better linked and leveraged by the public information teams. We will have more information on this one when the report from the smoke modeling comes out and later in January, but really thinking carefully about what those connections are between forecasts and modeling and other parts of the team, including public-facing communication and how that information gets shared. So I will end with a couple concluding thoughts. One is on promising practices and applicability in other places. We highlight throughout the report several areas where learning can be transferred to other places and work groups trying to do something similar. The community response plans and a lot of the structure that was already in place in Bend was really critical to the success of the work in Bend and could be a consideration for modeling in other places. So community response plans, tabletop exercises, advancing these partnerships. And then I'll just share, the other thing that we saw in West Bend is that it was well-resourced to do this work, and thinking about how we apply this in other places and other communities that might not have the same pre-existing resources will be a really important part of the learning that we see moving forward in this space. Again, apologies, my slides didn't work, but it does mean I got through it faster. So thanks everyone, and happy to follow up with questions.
Thank you, Heidi and Ryan. Heidi, nice job staying on your feet despite technology trying, otherwise. We're going to go and hear a little more about how these efforts are informing agencies' work moving forward. Before we get there, I want to remind folks again, if you have any questions, throw them in the Q&A, not the chat. But for the synthesis, I'd like to introduce Erica Sasser, Director of the Health and Environmental Impacts Division within EPA's Office of Air Quality Planning and Standards. Joining her will also be Seth Morphus, the Smoke Management Specialist within the National Interagency Fire Center at the Department of the Interior. Erica, Seth, thanks for joining today.
Well, thank you, Jonah. It's great to be here with everyone. I hope you can hear me okay. I want to thank all the presenters for very interesting presentations about the specific on-the-ground experiences that they've had. And I want to draw some of the themes together in terms of what we have learned collectively across these exercises. As you've heard, each location was working, as they were working to scale up prescribed burning, each of them was facing a different set of facts on the ground. So each problem was different. And that said, there were still a lot of commonalities. And I think you heard that in the presentations. And I should have started from the beginning taking a tally of the number of times words like share, listen, learn, communicate, those terms were used over and over again as people experienced, this process. And one of the things that we've come to really appreciate in hindsight is that these tabletops are not single events. They are processes. There's pre-work, there's post-work. Many of the conversations continue for a long time, for months or years after the initial event takes place. And it's really important to continue that dialogue because that's how the partnerships get strengthened. Along the way, we've learned a lot, and I'm going to share one slide, just one slide, where, let's see, hopefully you can see that. We're going to summarize our, can you see that? I'm not hearing any notes, so.
Unfortunately, not yet.
Oh. Okay, it's showing me that you can.
Sorry to say, I don't have a lot of good troubleshooting. I can't see any indications on my side.
Right, let me try this one.
Oh, this is promising. Nice, we're there, Erica. Just go into presentation mode and you're all good.
All right. Are we there?
Yes, you are. Go ahead.
Okay, good. Sorry about that.
No, all good.
So just quickly here, I think the first thing that everyone has said is that these are very complicated situations. Each on the ground reality is different. And in each case, the challenge of expanding prescribed burning and other land management practices to reduce catastrophic wildfire risk has involves a lot of challenges. I mean, this is, protecting public health at the same time as ramping up burning, and the amount of smoke we're putting in the air is a big challenge across the board. And there are no simple solutions to this. So it takes a lot of collaborative work and innovative thinking to develop solutions. Number two, it's very important to include a lot of partners in this dialogue. Each of the teams that participated in these tabletops had a wide range of partners at all levels of government and across the private sector as well, included non-governmental actors, community groups. There's a lot of different layers that need to be addressed. And it works the best when you include everyone in the conversation. Relationships take a lot of time. And I think this is something that each of these teams is still working on, is really getting to know one another, understanding one another's equities, and making sure that there is adequate dialogue to help with the problems that are facing each location. So we've got to allocate enough time and space to foster these relationships. And we also have to make sure that the engagement space is safe so that people feel that they can share questions and learnings and that they can engage with one another in a way that allows us all to identify the gaps and try to fill them. We've got to make sure that we clearly define roles, responsibilities, and objectives. That really helps make sure that the complicated problems on the ground can be dealt with effectively. And everyone has stressed how important the shared learning is. Creating opportunities for shared learning by remaining open and committed to the process of exchanging knowledge is really important. We have to work to understand one another's perspectives, and no one has all the keys. And Jason really captured this well in his remarks. No one knows it all, and all of the perspectives are very important. And so we have to make sure that we're open to continual learning. We also have to understand what we're looking for. So this is about establishing metrics, thinking in advance about what we're trying to get out of these processes, what defines success. How are we going to know it when we see it and if we've achieved it? So sometimes this is things like acres burned or acres processed, the number of public health complaints or questions that come in. There are simple metrics, and then there are more complicated metrics that are actually the things that we care the most about. What is the health of these ecosystems? How do we know if the acres are treated so that if a more significant fire event occurs, the acres will not have that adverse catastrophic response, but in fact, the prescribed fire will protect the community and protect the forest ecosystem. So metrics like that are really important. We also need to think about supporting one another through sharing resources. This is a huge amount of work. It takes a lot of staff time, a lot of resources on the ground to make these events happen and to carry out the activities afterwards. No agency and no local partner can do this on their own. So we have to think about how do we support one another and share resources across the board. We also recognize the importance of speaking with a single voice. And this is hard because we all have different perspectives, but the public doesn't see different agencies. They see government. They often think of government as one entity. And so as we engage at the local level, at the state level, and during particular events, it's really important that we all speak with one language, that we speak with one set of messages, so that people are confident in what they're hearing from us. And finally, it's important to continue to evaluate and adapt. We've got to monitor our communications and look for partners who are missing. We've got to make sure that the process itself continues to function. So investing in the process that is robust and continues over time, and recognizing that our success over the long term depends on our ability to continually engage in evaluation and adaptation. So together, these tabletops highlighted a lot of important lessons for the future, areas that we want to explore, gaps that we want to fill, and best practices that we want to try to advance in other locations. We want to try to build communities of practice that can do these types of events and replicate them in other locations over time. And we also want to figure out how to support these events in terms of resources, because it is very resource intensive. And I want to share just briefly from EPA's perspective. We have learned a lot from engaging in these tabletops. They have been incredibly valuable for our relationships and also for our understanding of the problems. And they're not the only thing that we are engaged in. I think Jenna mentioned at the beginning a couple of other avenues for this dialogue, including the Wildland Fire Mitigation and Management Commission. I participated in that, and that was an amazing experience. 50 people from different backgrounds and different representing different interests coming together, and the amount of learning through that process was tremendous. We've done the same thing in WIFLC. We continue to value the engagement with that group, the Wildland Fire Leadership Council, and we look forward to continued engagement with WIFLC and the fruits of that partnership as the activities continue. We are very focused on how we can help our partners. And I think Gabrielle covered this well in her presentation with the exceptional events tools. We are looking for feedback. We want to make sure that we can pursue these mutual goals of clean air and healthy forests, and prescribed fire is a key part of that. So we really want to work with you all to figure out how do we advance the objectives together. And I think one thing that we have learned is that fire work is not optional. This is now, and this is the future. We are facing this work, and it's a critical investment, and we've got to make time and space for it. So I want to thank the invitation. I want to thank WGA for the invitation for presenting today. We look forward to working with everyone further. And I think now I'm turning it over to Seth Morphus from Forest Service.
That was correct previously, but just because we ran a little long, I want to make sure we respect folks' time and also end on the high note of Erica's remarks there. So I think we're going to wrap just a few minutes over our time. But Erica, thank you for that synthesis there and tying all these important exercises together. I regret that we didn't really have enough time to do the Q&A here today, but what we're going to do is we're going to send out a follow-up email with some of the resources that presenters discussed, as well as just additional items that people requested through the Q&A. If you want to reach out to anyone and you didn't get their contact information, you can email me. My name is Jonah Seifer. Email address is jseifer@westgov.org, or go to westgov.org. You can find me on the staff page, and I'll make sure that folks get connected with whoever they are trying to reach out to. On that note, I just really want to thank all of our presenters, all of our attendees for your engagement in this webinar. This is obviously a really important topic. It rests right at the intersection of the health and wellness of our people, of the health and wellness of our lands, and just all the important issues that WGA and the agencies stand for.